will show you how to apply a universal transfer sling, as seen here.
Raise the bed to a good working height, somewhere between the hip and waist of the shortest caregiver. The patient needs to turn to their side. The base of the sling needs to be at the level of the patient's coccyx or sacrum, as shown here with the pink tape. The centre of the sling also needs to be positioned in alignment with the patient's spine. Half of the sling then needs to be tucked and folded as much as possible underneath the patient so the patient can then roll back onto the sling. The patient rolls to the other side and the sling is gently pulled through and flattened out on the bed. The patient rolls onto their back. Each leg strap needs to be positioned underneath the patient's thigh. You can do this by threading the strap underneath the patient's knee and shifting the leg support underneath their thigh, making sure it stays flat. Cross the leg straps by threading one strap through the lowest loop of the other. You can see that this is the correct size sling for the patient because the hip strap is aligned with the hip and the shoulder strap is aligned with the shoulder. Lower the carry bar of the ceiling lift over the patient. Connect the sling loops to the carry bar hooks, aiming for the longer loops at the bottom and going shorter as you work your way up. This will put your patient in more of a seated position, ready for their chair transfer. It may be helpful to have the head of the bed up to help the sling loops reach more easily. You can transfer your patient after checking all the sling loops are safely attached. To remove the sling straps once the patient is in the chair, you need to gently remove them from underneath the patient's thigh.
1, 2, 3.
With the patient sitting forward, you can remove the sling from behind the patient's back. Here are some alternative methods for sling strap placement pending a clinical assessment. This is the cradle or basket method, where each leg strap is threaded fully underneath both of the patient's thighs.
And action.
For this method, the leg straps are not crossed, but support each leg individually. Thank you for watching. Please look in the description box for links to more resources.